Hello, my name's Peter Nugent and I'm here to talk to you about the Royal Flying Doctor Service of Australia and my strategic recommendations that I believe are necessary to ensure the mid to long-term viability of the RFDS. A little bit about the Royal Flying Doctor Service of Australia. Established in 1928, it is one of Australia's most respected institutions, providing medical care and emergency services, emergency health care to around about a third of Australia's population. That's 8.5 million people living in remote and rural areas around Australia. It provides telehealth services, mental health services, health clinics, as well as dental services and emergency evacuation, patient transport, and of course, yes, does respond in times of emergency, medical emergencies. So what are my recommendations for its strategy to move forward to ensure its medium to long-term viability? Well, firstly, I looked at an Ansoff matrix looking at perhaps potential market and the products and services that the RFDS provides. We know that market saturation in Australia is very good for the RFDS. Like I said, 8.5 million people. Are there new products that it could develop? Probably not. But are there new markets that it could move into? I think this is one area that needs to be explored. Diversification is not really a consideration at this stage. So I believe the greatest area, or the area to aim for, is a new market, and in that I believe an international market. I believe it's time that the RFDS looks offshore from Australia. How would it best enter that market? Well, there are a number of options. There could perhaps be a exporting proposition, not really viable for health services. Licensing and franchising, yes, possibility, but this could cause reputational damage if, for example, the healthcare was not up to the same standards as the RFDS. A joint venture, I believe this is probably the best scenario. Finding someone perhaps who already operates in the same medico space in a country that the RFDS could perhaps potentially operating a wholly owned subsidiary, which is the fourth option, is probably too slow and too expensive. So using some Johnson et al. Analysis, we're going to look at internationalisation. So the areas to consider here are market, government, cost and competition. So the market is there. I'm thinking particularly this venture is delivering COVID-19 vaccines to India. So the market is there. We know that there is a need for vaccines in that country that's currently going through a terrible situation. We know that it's not that far away, so it's a possibility that there are opportunities for the RFDS to move there in a short term, quite quickly and quite easily. Their economic, the governmental setup is much the same as Australia. They're a liberal democracy, so therefore they have the same sort of parliament and political systems. The economy is the same too. It's a free market, so there are no obstacles there. And we know that there is a massive population there. There's 1.36 billion people living in India, so there is a great need for vaccinations and there's a great need to have them quickly. So using a fourth method of analysis, the CAGE analysis, so looking therefore at culture, administration, geography and economy. As already discussed, I believe India ticks those boxes. They have a similar culture to Australia. On many levels, they are a democracy, so I believe the RFDS, with the experience and the knowledge that they've got here in Australia, would be able to easily adapt their working model to apply it to India, particularly in the delivery of the COVID vaccination to remote and rural areas that are perhaps too hard to access by road or by train or other transport methods. Fly the vaccines in and get it to the general population as quickly as possible. Remembering though, that strategy has to be agile and adaptive. As we've seen with this pandemic, we don't know what's around the corner. So let's start off on a strategic direction, but don't forget that perhaps it may need to be adapted along the way to meet changing circumstances. The first step that I would recommend would be the establishment of a steering committee made up of the RFDS executive, members of the medical sector of the organisation, the aviation sector and the accounts sector, to look at if in fact this is a viable proposition. Does the organisation have the scope and the capacity to start to deliver medical services into new markets, into overseas markets? I would also employ an external advisor to identify potential joint venture partners. So there you go, in a nutshell. Time for the RFDS to perhaps look at expanding into overseas markets where there is a new stream of revenue possible for the organisation. Time for the Royal Flying Doctor Service of Australia to spread its wings.